Good morning. We've still got some couple people coming in. We'll start in just a moment. So we will go ahead and get started then, I think. So welcome to Partners Community Cafe. And I think we have a great topic for us today, talking about mind and body. You are what you eat. My name is Jeannie Patterson, and I will be your host today. We've got a great group of people ready to talk. So we're going to go ahead and get started. So first up is Amani Pagis, who was one of Partners trainers, and she's going to talk to us about the connection between nutrition and mental health.
Thank you, Jeannie. Good morning, everyone. I am Amani Pagis, and I'm the health educator with the Partners Community Engagement Team, the training team with community engagement. And today I'm speaking about nutrition and mental health. So one of the trainings that I lead is nutritional impacts on mental health. And a little bit of that information from that training is going to be presented today. So you may have seen this before. But if you think about food and mental health, you may have heard of the term nutritional psychiatry. Nutritional psychiatry is a new and emerging field. It's been around maybe about 10 years now, which is fairly new for a field of study. And what it focuses on is preventing and treating mental health conditions through supplements and diet. And if you've seen like a article or a news segment about food and mood, then you've been exposed to nutritional psychiatry and those ideas. Nutritional psychiatry also looks at understanding brain development with the impact of nutrients as far as brain development. And this is from birth to senior years. So, how the food that we eat and the nutritional value, how that impacts brain development from birth to senior years. Next slide, please. So, in speaking about nutrients, specifically focusing on micronutrients in the brain, vitamins and minerals in our food, it helps to establish and maintain our brain structure and function. So, it helps our brain work the way that it's supposed to, as far as our cognitive abilities. And just increasing nutrients in the diet, making sure that we're getting nutritious foods. This is being seen as a global strategy to help combat against mental health issues, but also non-communicable diseases, like our physical health diseases such as diabetes, heart disease, hypertension, and those things. And then lastly, as far as dietary guidelines in the United States, just to encourage people to eat this way and get a wide variety of nutrients in their diet. We do have dietary guidelines, My Plate, and that is to encourage people to eat, to have a healthy weight and to be physically fit, but also it helps encourage mental health as well. So, in talking about nutrition, we do have to just acknowledge and highlight that everyone does not have the same access to food. And as far as the conversation with food insecurity, we know is when people don't have the resources, means to be able to get the food that they need. And it has been shown that food insecurity can actually increase the likelihood of experiencing a mental health condition. It can have you at higher risk for depression and anxiety. It can also undermine the social relationships you have because you can feel alienated and deprived. If you think about just a lot of the traditions that we have in the United States, a lot of those traditions are around food. So whenever you don't have the means to be able to provide a certain level of food, it can be stressful. But on the flip side of that, as far as the programs that help to give people access to food, it can really promote their holistic well-being. So not only does it help them have the food that they need to be able to sustain their health, but also their social well-being as well. It really promotes mental health. It promotes community resilience, just as far as having that support and feeling like your neighbor is looking out for you. So this is a short video that I found. Is talking about inflation having a negative impact on nutrition choices. I thought that this was pretty interesting because although currently inflation is decreasing, we're still seeing high food costs, and just seeing how that impacts folks as far as their food choices, and then in turn also their health outcomes as well, both physical and mental.
Well, from the gas station to the grocery store, we are all feeling the squeeze of inflation.
Yeah, just look at the numbers. According to the Bureau of Labor Statistics, the price of eggs has gone up nearly 40%, butter is up 24, milk 17, and cereal, to go with that, 16% higher.
Inflation and nutrition go hand in hand. Because of those rising costs, people are buying less expensive foods, and less expensive often means less nutritional value.
Now, doctors across the tri-state area are seeing the effects. Joining us today is cardiovascular disease expert Dr. Nidhi Kumar to explain all of this. Thanks so much for taking some time to talk to us. We really appreciate it. So how are you seeing the effects of inflation medically?
Yeah, so the changes that we're seeing, unfortunately, are not subtle. We are seeing big changes in numbers, increase in blood pressure, increase in blood sugar, and increase in blood cholesterol. Sometimes the more economical choices are not the healthier choices. And unfortunately, we're seeing these changes already in the doctor's office.
So we're not talking about just a physical issue, as you mentioned, but it's also a mental issue. They're kind of combined. So what kind of effect is that having on people?
So there is a very strong dose-response relationship between food security and mental health. So the less food secure you are, the worse your mental health. Yeah. So we're still dealing with the mental health fallout from the pandemic. Yeah. And so this food inflation is only compounding these issues. I had the opportunity to talk to a colleague of mine, Dr. Robert Cohen, and he is a psychologist and professor associated with the NIH. What he shared with me is patients that are food insecure are experiencing more anxiety, more stress, more depressive symptoms. And that worry carries into the household. So it creates very stressful conditions in the home, and children are very vulnerable to this type of stress. It can affect their mental health, it can affect their academic performance. So we are seeing a very broad range of physical and mental effects.
So that's what I wanted to ask you as you discuss children. Who is being the hardest hit here?
So right now, the hardest hit group actually are our seniors. The seniors make up the largest group increase entering into the emergency food system. You think about it. So there's fixed income, high cost of prescriptions, and now high costs at the grocery store. So people are having a real challenge making it all work. 63% of seniors that are visiting food banks are actually saying that they are eating less to pay for medical costs. And then after seniors, it's low-income families. A recent study, it was over 3,000 participants done by Coupon Birds, found that 42% of people are saying that they are either cutting down their portion size or skipping meals. So not only are we seeing physical changes and mental changes, but people are actually changing their behavioral patterns to deal with this food inflation.
So now let's talk about solutions. And you say you have split them into three categories: government, community, and household. So let's start with government. What are some of the solutions we see there in that?
So from the standpoint of the government is absolutely responding, which is great. We are seeing increased available funds in the form of food stamps, WIC. In 2023, seniors are going to see a rise in their Social Security allotment, over 8%. So we're hoping that's really going to help. On the community level, it's important for us to access what we have in the community. Food banks, we have community kitchens, we have local farms. These economic structures exist. These are emergency economic structures that exist to actually help support us during this time.
And what about if you get down to just the household? I mean, what can people do? What can families do? What can seniors do within their own residence?
Right. So I think it's about being creative. So if we are creative and we make different choices, there's actionable steps that we can take to elevate the health in our household. So for example, well, let's just, kind of first just talk about what are some of the pitfalls we're making at the food store. So it's a lot cheaper to buy canned vegetables, right? But the problem is when you eat something out of a can, you're taking in a lot more salt. And that bump in sodium can increase your blood pressure 40 points. So an option is buy frozen vegetables. They're a fraction of the cost. You can buy in bulk and you get the same nutritional value.
I think you're also, I was just seeing there that you were recommending people, instead of buying meats, maybe choose lentils, which are high in protein.
Right. So globally, worldwide, 1 billion people use lentils as their primary source of protein. So if 1 billion people are doing it, there must be something to it. It's a fraction of the cost. Again, a cup and a half of lentils is the equivalent of a chicken breast. So it's a great way to supplement a few meals during the week. And also, important to stay away from those processed meats, because processed meats, again, less expensive, but you're increasing your fat and your salt content.
The nutritional value in lentils also is fantastic as well.
Absolutely. And then I love to talk about cauliflower. I mean, you would think I'm invested in cauliflower. I'm not. I love to talk to my patients about it because it's got high nutritional value. It's a great substitute for carbohydrates like pasta, like rice. A head of cauliflower is less than $2.
Such a great idea, and thank you so much for your advice here. So important. Dr. Kumar, thank you.
So that video was a couple years old. It's about 2 years old, but I feel like it is still relevant. It has a lot of good information. And I liked how it shared about just the interventions that can happen on each level, individual, community, government. So lastly, I would just like to share just as far as our training team, we do have our flyer out right now for our August trainings. So if you would like us to send you that, you can reach out to us and we will get that to you. Specifically, if you would like to register for the next nutritional impacts on mental health training, that will be next month, August 29th at 10 a.m. and it will be via Zoom. And then also, whenever we do our trainings, we do send out a post-training survey. And on there, you can tell us about how you felt about the training. But also, we do ask for suggestions for future trainings. So if you do have just ideas, we would like to hear about those. So thank you all, and I look forward to all your questions. And there's my contact information. If you would like to chat with me, you can reach out to me.
Thank you. Thank you, Amani. So does anybody have any questions or comments for Amani? I'm seeing someone has asked in chat, and we will get you we will send the flyer to you, Thomasina. Any questions or comments for Amani? Yeah, Destiny's pointed out that video is definitely still relatable, even if you're so old. If there are no other questions, we will go on to our next speaker. So I'd like to introduce Brittany Holbert, who was with Feed NC, and she's going to talk about serving dignity.
Hi, all. Thank you so much for having me. I'm excited to share this topic with you all. Just bear with me for one moment as I get my PowerPoint up.
You're on mute, Brittany.
Hi all, thank you. Can you all hear me now?
Yes, that's good. And your PowerPoint looks good too.
Perfect, thank you so much. And I'm sorry, just bear with me one more second. I'm trying to. I do a lot of presentations live. I don't do a lot of virtual, so this is a little new for me. Okay. All right. So right, every one of us at some point or another in our lives has encountered situations where we needed to ask someone for help. And it didn't matter whether the ask was seemingly big or small, but I think we can agree that sometimes it's just really difficult to ask people for help. And some people struggle so much with asking for help that they wind up not even asking for that help. And they just simply go on with an unmet need. And because of fear of rejection, burdening others, trust issues, pride, doubts on others' abilities to help, or maybe even just a belief that no one cared to help them, they don't actually ask for help. And then there are those times when the need simply can't go unmet, when we do have to ask for help, and that sometimes doesn't make us feel really good either. And that's because what it does is it elicits an emotional response from us, sometimes like frustration, vulnerability, fear, shame, sometimes even feelings of inferiority. So, how do we as service providers attempt to combat this innate part of our human condition to help our clients retrain the brain to feel safe asking for help, especially when the stakes are so high, like not having enough food or the right food to eat at home? At FeedNC, we believe that no one should ever feel bad for needing help or afraid to ask for that help. And this is why everything that we do at FeedNC, we do it through what we call the dignity lens. And that's what I'm going to share with you all today. And to really understand how we go from asking for help to that operational dignity lens, I'd like to just kind of start where we started at the beginning. So FeedNC started out as Mooresville Soup Kitchen back in 1987, just providing hot meals to anyone who needed it. Over the years, the organization started to realize that we could and we should do more. In 2017, we went out knocking on doors, asking families in our community a very simple question: what do you need? And just from listening to our neighbors in need, we found that individuals and families loved the meal and they found it very helpful, but they needed a little bit more. They wanted groceries to be able to cook at home with their families and healthy options. They wanted opportunities to earn livable wages to be able to be independent and provide for their families. They wanted space to create community, and they wanted it to be a space where they can feel heard, valued, and dignified. We put the programs into action with the help of our valued members, and together we built and moved into our new facility, which is on the screen, in the spring of 2023. And this is where we now offer 20 innovative programs around food security to families in our community. At FeedNC, we have bucketed these 20 programs into 4 community investment categories that lead our focuses as an organization. And in providing these services with dignity at the forefront, we foster a sense of respect and empowerment for individuals, which can significantly enhance mental well-being and self-esteem, because we know that feeling valued and heard contributes to a positive environment that promotes better coping mechanisms and emotional resilience. So some of the programs that we do offer, again, around food and nutrition security, workforce development and education, agriculture and sustainability, and social capital and dignity. So when asked to present on a You Are What You Eat concept, what resonated most with me in relation to FeedNC programs, surprisingly, wasn't what we do, although we do work diligently to provide food insecure families with nutritious food and education around that nutritious food, but it was really how we do it. So we look at something called a dignity lens. So I like to look at this as a lens because I believe that this is the first view that we should all be looking at as decision makers and service providers. And if we're truly examining these components during those decision-making processes, I feel confident that we will maximize how dignified folks will feel when attending and engaging with our services. First, I encourage listening to the perspective of our members and striving to model the treatment we would like to receive ourselves, and to do that over and over and over again. We know that populations change, the need change, there's constant questions arise. How can we do better? What can we do better? How can we best serve the community? So I recommend anyone who is in that service field to never stop asking your people those questions. And then once you ask those questions, you want to foster that collaborative environment where you can then build together and let them be a part of the solution with you. And then last, we encourage engaging in creative thinking and embracing innovation by exploring novel approaches and experimenting with new ideas. So just trying different things and not being afraid to fail, because you never know what's going to be truly impactful to people. So I just wanted to just jump into a few of our programs that we offer here at Feed and See, and how kind of using that dignity lens modeled how we now do our programs. So first, we, again, 1987 had a soup kitchen model. We now in 2023 had revised into a community dining model where anyone was welcome to come for the community and take part in the community dining. There is no payment required for the meal. So anybody is welcome to come in, enjoy a delicious meal. Nobody knows who is making a contribution to the organization or who is not. So it kind of creates that space, safe place that promotes mental well-being and also provides nutritious meals to families, creating positive childhood experiences and memories. So what we really try to do with all of our programs at Feed and See is we model it in a way that when a child comes or even an adult comes, they're not going to say, hey, like, remember the experiences. I went to a soup kitchen when I was younger. It's like going to a restaurant like every other child has. So we want to create that same experience for everyone. And then third, we have an a la carte menu. So this was a new design we were super, super excited about. So as a soup kitchen, for the past 30 years, it was one meal a day, and it was whatever we were serving. If we had ham, green beans, and potatoes, everybody was eating ham, green beans, and potatoes. So we're super excited in 2023 that we're able to offer an a la carte menu, which has gluten-free, vegetarian, vegan. We offer for dietary restrictions, so people can actually order what they need. So this is just an example of the menu. This is our breakfast menu. So anyone who comes Monday through Friday from 9 to 11, these are the different items that they would choose. Again, it is all free of cost. So anybody is welcome to come and enjoy a nutritious meal. We are focusing on the nutrition here. And then this is our lunch menu. So Monday through Friday, 11 to 2. If you came here any day or anybody came here any day, this is what they would expect to see on the menu. So again, we do try to have healthy options. And if you look in the bottom right corner of the menu, you could see the vegan, vegetarian, and gluten-free symbols. So we are making sure that we have those options available for folks as well, because we want to create that dignified experience. We don't want to just say, we have ham, greens, beans, and potatoes, so that's what everybody's eating. And then our kids menu. And again, this is all donated food that we use to facilitate this program. And then we have our grocery program. So some changes we made to that. We do one member choice empowerment. It's set up as a full grocery store. So back in 2017, 2018, we used to just have boxes of food. Most of it was canned goods that we would just hand out to people who were in need. We asked them, hey, what do you need? What can we do better? How can we best help? And our folks actually said, we want to be able to choose, where we're going home with stuff that we don't really like, we don't really need, we can't eat. So we offered a member choice option. So families were able to come access the grocery store and pick out what they need, healthy options for their families. And then we elevated the experience through leveraging technology. So in 2022, we started using a mobile app. So our families who are registered for services could go on our free mobile app, and we have an online self-scheduler for their appointments. So they make their grocery appointments as whatever works best for their schedule based on work and doctor's appointments and childcare. Instead of, previously we just had, these are the days and time we're open, Wednesday, 11 to 2, hopefully you can make it, which wasn't effective. And we weren't hitting those families who, had other obligations. So we leverage through technology, and then promoting dignity through terminology. So back in, I believe it was 2021, we actually shifted from calling it a pantry to a grocery. We also shifted from calling our clients to members. We asked them, hey, what would you prefer to be called? And majority of them actually said members because it made them feel like they were a part of something. Similarly to grocery, we want to feel like we're going to a grocery. We don't want to have the stigma of going to a pantry. So that's kind of where we changed that terminology.
I mean, I think they might know that they make.
I am so sorry because this is the wrong version of my PowerPoint, but we're just going to keep going through. We have workforce programs as well. So some things that we're doing there is we're fostering a sense of accomplishment. So one thing that we do with our workforce programs, helping people get jobs, is the graduation component. So it's been really cool because a lot of people say, hey, this was my first time ever having a graduation. So it's a special day that their family and friends can celebrate with them. So they're fostering that sense of accomplishment with the family and friends. And then promoting independence. So being able to, again, back in 2017, when we surveyed our members, they all said, hey, we these are things we want. We want to have livable wage jobs. We want to be able to provide for our families. So we took that information that they gave us, collaborated with them, and then we created this program to help them promote independence, to get the skills to get those jobs, to be able to be at livable wages. And then creating an avenue for reduced reliance on services. As you can imagine, being able to exit out of services is a goal for a lot of folks. So to create an avenue to help people do that was something that people really loved. I will show the next video because we will miss our ending video, but this is just kind of an impact of how the Feed and See services and looking at it through a dignity lens are helping families.
I barely had $2, in my pocket. Self-esteem was down. Of course, I didn't have no job, no nothing. I actually given up on myself. And I met somebody and they told me to come and they gave me an opportunity to do this warehouse program with the help of you guys and the program and everybody here. They got me a job, got some money in my pocket. Something I live by now is like, if I make a promise, I'm gonna fulfill it. My boys are my world, so they never been on an airplane. They never been to Florida. There's a lot of family members that they haven't met. I wanted to accomplish that all in one with the opportunity you guys helping me build up my skills. I actually had a chance to save money, and my goal was to fulfill that. And I fulfilled it. Oh man, I love it. Yeah. Oh yeah, I love my boys. That's what you guys did for me, but I appreciate it. Y'all did your job with me, and I appreciate it so much. Thank you.
So that's just one of our impact videos of how doing services with dignity and really, allowing members to collaborate really drives the programs. And then the last one I want to touch on is the produce garden. This is a new addition, 2023 when we moved into the new building, but still working on it, trying to figure it out to this day. So this is just kind of my drive home onto thinking creatively and not being afraid to innovate and do different things. So we were told repeatedly by our members over the years, we want healthier food, we want produce, fruits, veggies, more access to these foods. So we operate based on donations. So we're like, how do we get more food, more healthy food, more sustainable food into the hands of our members? So we had no idea how to garden, and we said, we're going to do a garden. So we collaborated with a lot of partners. We are still learning every single day, but right now we do have a half-acre produce garden. So this is just kind of my hurrah to thinking creatively and to not be afraid to go out and try it. We didn't know how to garden. We never gardened in our lives, but we said we're going to find the right resources, we're going to find the right people, and we're going to create a solution for these families to make sure that we can get this fresh produce in their hands. So that is pretty much it. We are just promoting the chance to make a change, and that is pretty much it. So if you have any questions, please let me know.
Thank you so much, Brittany. So I'll be happy to ask a question. I'm thinking maybe a lot of us are thinking about that, is that I just love hearing about your program and thinking about how that could be replicated in other places. And of course, the first question that comes to my mind is, talk about funding. How did you come up with the funds to do such an amazing program?
Yeah, thank you so much. We are very fortunate to have donors who believe in the mission and believe in what we do at Feed and See, and know that we make sure we are good stewards of donor dollars. We are privately funded. We very seldomly do any federal or state funding. That does give us a little bit of freedom to do different things and trial different things in ways that some funding that comes from certain organizations might have restrictions on. So we have a very wonderful community, a reputation in the community of over 30 almost 35 years, where we have a lot of community engagement and donor support.
Great, thank you. Anybody else have any questions for Brittany?
Hey, Brittany. Hey, good to see you. Hey, so on the previous presentation, you talked about the demographics of our older population being cash short, right, for nutritional foods and such. So do you all monitor numbers or look at how the things have changed over the last couple of years as far as the demographics, ages and so on that are visiting your center?
Yes, so we look at that regularly. So we do an initial application for everyone who's coming into services. And then we do recertifications once a year. So we're recollecting that information if that has changes within the household. And then we do member surveys, either annually or biannually, just to kind of, again, collect additional information, because we know, as you know, Rob, that it's always changing. So to kind of stay on top of it. And good to see you, by the way.
Any other questions or comments for Brittany? Brittany's contact information has been put in the chat, thanks to Amber. So if you want to know more, reach out to her directly. You're certainly welcome to do that. I'm sure I will think of a lot of other questions, Brittany, so I may be in touch as well. But thank you for being here today, and thank you for all the work that you do, that you're doing for the community, the model that you're setting.
Thank you very much.
So if there's nothing else for Brittany, our next speakers are Crystal Hoke and Mary Garris, who are with partners in the Population Health Department. They're going to talk about the correlation between mental health and physical health. And I need a moment to pull up the PowerPoint now. So. Ladies, I want to get rid of my stuff on my screen. Hang on. There. Does that look okay, everybody?
Yeah, that's good. Good morning. I am Mary Garris. I am one of the registered nurse consultants here at Partners. So this morning, we are going to talk about the connection between mental health and physical health. And you could go to the next slide, please. So how does mental health affect our physical health? There actually is a big correlation between the brain and the body. Stronger connection between the mind and the body than many of us think. Good mental health can have a positive and a direct effect on our physical health. And one should never ignore any mental health struggles that they are facing, whether that be anxiety, chronic stress, PTSD, depression, any struggles you're facing, we should never kind of put that to the back burner. That's something that we should always seek help for. Next slide, please. So mental health. So how does mental health affect my physical health? Nearly 1 in 3 with a long-term physical condition also experience a mental health condition. Most often, that's going to be anxiety or depression. Research shows that those with a mental health problem are more likely to have a preventable physical condition, such as some type of heart disease. And this can be due to genetics. It could be due to low motivation, difficulty concentrating, lack of support, or these people sometimes just less likely to get medical care. And next slide, please. Okay. And again, how does mental health affect your physical health? So genetics, of course, genetics affect everything. But the genes make it more likely that we will develop a mental health problem may also play a part in physical health problems. Environmental factors, and I'm sorry, they're supposed to say can, be a large contributor to mental health. So that could be trauma, emotional harm, substance abuse, low motivation. Some mental health problems or medications can affect our energy or our motivation. So that can also cause a large or a problem with our physical health, and also difficulty with concentrating or with planning. So some find it hard to attend appointments or with concentrating if their mental health, if they're having problems with their mental health at that time. Next slide, please. And how does mental health affect my physical health? Lack of support to change behaviors. So healthcare professionals could assume that one is just not capable of making changes. They may fail to offer support on smoking cessation or drinking. And many times, this particular patient or member, they may just not receive medical help. They're less likely to go for their routine health checkups, their routine care. If they did, however, it could alleviate some chronic conditions such as hypertension, obesity, hyperlipidemia, all your chronic health conditions. And so here this is just a little picture, what is more important? And of course, mental health and physical health, they're both important. Next slide, please. And so mental health problems can come with physical symptoms. So our bodies and minds, they are not separate. So it's not surprising that mental health can affect our body. With people that struggle or with anxiety, it can create an upset stomach, can cause us to have sleepless nights. So that insomnia can kick in. We can be very restless, just difficulty concentrating, and feelings of impending doom. These can also cause stress on the body and can also lead to problems with our blood pressure. So, hypertension can cause some to gain weight, can cause heart disease, and also can cause many other issues physically. Depression is another thing that can affect us as well. Headaches, fatigue, digestive problems, and other problems that can affect us physically. And these physical symptoms can manifest differently in everyone because no two people are the same. So what one person experiences, the other person may not. And then of course, with chronic stress, it can cause that muscle tension that builds up in your shoulders. Some people weight gain, some people weight loss, digestive issues, of course, again, insomnia, heart disease, high blood pressure, and it also makes one more susceptible to certain cancers as well. Next slide, please. Okay, and things we can do to help ourselves. So having a mental health problem doesn't mean that you're going to develop a physical health problem necessarily, but there are things that we can do to give ourselves the best chance of staying physically well. And that's going to be to exercise. You know, it's good to try to exercise, to walk at least 30 to 45 minutes, at least 5 days a week. Make sure we're eating well. So that all this, you know, processed foods and stuff out here, try to avoid processed foods, but you know, we need our protein, we need our vegetables, things like that, fruits, veggies, adequate sleep. And I know many of us are probably guilty of not getting adequate sleep from time to time, but getting adequate sleep is very important. Move more and sit less. So having a, you know, work at home job. I know I have to train myself. Actually, my watch reminds me to get up and move more. So that's important too. Stop smoking, vaping, or chewing, just because the tobacco element there can cause, you know, some problems as well. And then limit our alcohol intake, just because we want to, you know, take the best chances of being able to stay physically, you know, as well as possible. And next slide, please. Okay. And then things we can do to help ourselves. So make sure that we are attending our regular yearly physicals, our appointments with our providers. We have our annual screenings. So our, you know, colonoscopy when that's time, our mammograms, those things, and our vaccinations are important. Connection with others is important. So be involved with the local organizations, you know, whether that be, you know, helping out with the food bank, being involved in church, just doing different things in the community. Make sure we take time to unwind, because I know sometimes that's a challenge for me. But we need to make sure that we take time for ourselves and take time to unwind. Disconnect from social media. That's hard for many of us too, especially with all the negativity and things we see going on in the world today, but try to just disconnect from social media and take time for ourselves. That's important too. And next slide. Okay, and then of course, this is the references right here that we used, Center for Disease Control and then Mental Health Foundation. And then now Crystal is going to talk about some of the different some of the different things that Partners offers to members as well as staff.
You're muted.
Yeah, you're on mute.
Christy.
Sorry about that. Okay, so with Partners, we offer our Teledoc health program. And, oh, sorry, I closed out my page I was on, sorry. Okay, sorry, the Teledoc health program. We also have the Health Check 2020 program. There are some self-health assessments. We have the PICS Health that is available. And then in certain counties, they do have the Healthy Opportunity or HOP program available to the members. And if you would like further information on that, our contact information is available in the chat. Thank you.
Thank you very much, ladies. Does anybody have any questions for Mary and Crystal? Or I know that Amani and Brittany are still on. If anybody has any questions for any of our speakers today. thank you very much to all of you for giving up your time and coming and presenting, talking about this important topic. We just thank all of you and just love the programs that you're offering and appreciate your work and your willingness to be here today. And now I'll ask Amber if she will kind of bring us home.
Yes, thank you guys again. Just as a quick plug for next month, Community Cafe will be highlighting National Wellness Month, and it will be taking place on Wednesday, August 28th at 10 a.m. Hope to see you guys there. Thank you.
Thank you all for being here today.
Thank you.